Basically the assumption is patient head that way, foot this way, facing up. So this automatic exposure control is just show the whatever dot is actively detecting the patient's location, and then do the automatic compensation of X-ray. And if the patient's position different, you can change the face down or head this way. So that is the definition of the correct location. Zoom level is very easy to understand for the picture, and this one is show the light for what's current X-ray coverage area. You can collimate small, yeah, this is easy to control, and take that out, just cancel that button out. This is showed no X-ray, then you have the technology have to activate it for us. This one showed no X-ray, and this one is not active. The tech have to this one shows grid, so all the adult patients have the grid on default, and then the pediatric patient, you press that, the grid will be removed. And this one is basically remove all the hand setting to go back to default protocol. So the low radiation and the low rate of fluoroscopy is good for routine, for example, barium swallows, but for esophageal study, unless patient's too big, you can increase the radiation dose by changing that. And also the modified fluoro, they want a faster 30 second per certain frame per second, and then press that. And this one is save all the pictures of fluoroscopy pictures, all automatic save. And the tech may not like it because they have a lot of images, a lot of data. And this one is for once you see a good exposure, if for example your patient move, you lock it by yellow, and then the patient moves, it's okay. The setting is safe, so there will be always same radiation. Of course, you have to unlock it to move to a different part of the body. Compression, you can move the compression spot by just moving the joystick, except by moving the patient, the compression paddle will automatically raise and move the patient, and then I have to push back, physically press that button down to activate the compression paddle. This one is exposure 1 per second, or you just choose to whatever selection you want. Usually 3 per second. So this is a direction, and this two buttons is very important. One is the technologist view. Basically, they move the table, look at the table, and then they move it. And then for the radiologist, look at the monitor. This is the button to use. And then if I push the button, if the joystick to the left, I'm looking to the left side of I'm moving towards the left side of the screen, not left side of the table. So for radiologists, it's better to use this setting, and which is this. Technologists better use that setting. And then when we walk in the room, we better make sure it's in the radiology setting so that we can move the way we want it. This button is for saving all the fluoroscopic images that last seen on the screen. That's a very useful technique in case you didn't catch it in real exposure. The paddle is the only way to take exposure. Review of the images, you gotta go out to the room, outside the room to review. And then this thing, when this level is at the notch level, that's about the normal exposure distance. Even though it can raise a lot higher, it can tilt left and right, but not lateral. So we don't do this room we don't do a lumbar puncture using this room. And that's it. That's emergency brake, stopping the motion. We rarely use the keyboard. And then this is a monitor I can move around. The machine only knows the ceiling and bottom and left and right wall, and doesn't know the location of the cart or the monitor. So make sure they are out of the way before you move the table. The other cart is for modified barium swallow annotation, not for a radiologist. And that's pretty much it.